over 700 years, physician-assisted suicide has been talked about. People have been going back and forth debating on whether or not assisted suicide is even ethical. What is physician-assisted suicide? Assisted suicide is when physicians provide a lethal medication for the terminally ill. This is usually asked from the patient to doctor. In 2011, a 41-year-old man named Ethan Romano took a lethal dose of a prescription sedative that was requested such from his physician. This man became one in 25 people to exercise this option under the Washington's 2009 Death with Dignity Act. The Death with Dignity Act allows terminally ill adults seeking the end of their lives to request lethal medication. I am personally an advocate of the Death with Dignity Act because it exercises our right of free will and eliminates hefty costs of the ICU. Everyone has the right to their own life, and allowing the terminal ill patients to choose their own death with a little help should be a part of that right. This is commonly looked at as unethical if patients who are terminally ill wish to end their life. With proper assistance in such situations like this, it should look at it as more ethical than taking lives into their own hands. Aside from the ethics, hospital costs for patients who are terminally ill is a tremendous factor for people to consider assisted suicide. The average cost for one day in the ICU is around $4,000 per patient. A patient who stays in the hospital for 5 days can make the price extend to about $10,000. These hospital costs will bury families into difficult financial situations. Medicare in 2018 spent $55 billion in inpatient bills and hospital bills during the last 2 months of the patient's life. After life or death situations cannot fully be put into perspective until one person's dealt with or related to them. My grandfather has experienced terminally ill cancer that began in his throat. Not long after, it began to take over his whole body. He was given 2 years to live. He went through his first round of chemo, then refused treatment after. Medical bills were piling up and decisions had to be made. My grandfather, if had the Death with Dignity Act available to him, he would have chosen that path. The Death with Dignity Act is only available in 5 states: Hawaii, Washington, Oregon, Vermont, and Montana. Some people like to argue the Hippocratic Oath. This oath states, "I will keep the sick from harm and injustice. I will neither give a deadly drug to anybody who asks for it, nor will I make or suggest this effect." Doctors argue that they became doctors to save people's lives, not to end them. A survey that was taken on doctors who treat cancer patients said 22% of doctors agree with assisted suicide. Suicide can affect a large group of people, not just your family and friends, but the doctors and nurses that are close to the victims. It is commonly brought up that assisted suicide is unethical because there are some people with mental disabilities and illnesses that are not in the sane mind enough to make such a big decision. At this point, it is unethical to put one's life into another person's hands. If this is considered unethical, then should it be terminally ill patients in this state of mind to be able to make a decision on any treatment? This would be up to the lawmakers to decide, but this argument does not seem even at this point. Ending someone's life should not be sad or frowned upon. Anybody should be able to talk about what they want and how they would like their life to end. Thousands of people have chosen assisted suicide, and the states that people do not have this available to them, they go as far as moving just to make it happen. After weighing out the pros and cons of physician-assisted suicide, it is safe to say that patients should always have a say in what they get to do with their life. That being said, physician-assisted suicide is not for everyone.